All right, welcome. So here in this video, I would like to go over the anatomy of the vessels so that when you come to lab, you spend your time doing the actual identifications on models. So first, is this a vein, an artery, or a nerve? So classically, your arteries are pressure vessels. They hold the pressure. Your veins are volume vessels. They hold a lot of the volume. About two-thirds of the blood volume is in the veins at any point in time. But one huge difference is the amount of muscle in the cross section of both types of vessels. So this, for example, is an artery, and this is a vein. You can see how the lumen is kind of collapsed. It's a bigger vessel overall, but the lumen is collapsed because the veins do not have pressure of their own, so they require the pressure of your muscle pump or gravity to help things move through them. Whereas on the muscle, you must have a an open, usually almost round or oval lumen. You can also see layers and layers of muscle right there. You can almost see that it's kind of in lines. Those are muscles. Do veins have some? They do, but a lot less. These will be the nerve, and those would be, see those little white things here, will be the bundles of the axon that doesn't stain well because it's membrane, so that's why it's kind of white. So that's that. Um, and this is what that might look like in APR. So there are three layers of a artery. So there's the tunica intima, that's the endothelial layer, the innermost layer that is in contact with blood. You have the tunica media and the tunica externa. For a vein, I want you to notice here they do also have all three. The tunica intima is about the same as an artery, but the tunica media um, is relatively less compared to an artery. When I say relatively less, if you compare the entire um, thickness of the vessel, what proportion of it is the tunica media versus that of an artery has a larger proportion relative to the thickness of the wall, that is the tunica media. And then you have the tunica externa, which is um, a little bit larger in the veins overall. So let's go to some anatomy. So the ascending aorta, that's that one. The arch, that's the arch right here. Again, it's an arch. The first branch out of the aorta is that one, the brachiocephalic. Brachio. So brachii is your arm. So biceps brachii. That's your biceps muscle. So your brachio is the arm, cephalic is the head, and that makes sense. You have a branch that goes to the brachial part. Um, that's called the right subclavian artery. So that would be that one. And you have this one right here, which is the right common carotid artery. So that's this one right here, right common carotid artery. I think I should use a different color, so that's a right common carotid artery. And then so that was the first branch, branch number one. And then branch number two, here is the left common carotid artery. So that's left common carotid artery. Lansing Community College artery. And then So again, if you think about it, depending on what direction you're facing, Lansing could be left of Grand Rapids. Now think about it that way. Um, if you're facing south. And right here is my left subclavian artery. Okay, left subclavian artery. And then this becomes my descending um, aorta. A part of it is within, so this is the descending right here. A part of it is still in the thorax, that is in your chest area, and further down, out way below here, once you exit the layer of the diaphragm, the level of the diaphragm, then it's considered the abdominal aorta. And so we've just talked about so what is that? What is that? That's my brachiocephalic trunk. And what is that? That's a subclavian. Remember your clavicle, your collarbone, so subclavian, right underneath the clavicle. That one right there. And then that leads to what? So the other half of the brachiocephalic trunk is what? Is your right common carotid artery. The carotids take blood to the brain. And then the next branch is the left common carotid artery, and the right branch is going to be um, my left subclavian artery. Okay, and then you have here would be my thoracic aorta, and that would be my abdominal aorta. Okay, what is 1? What is 2? And what is 3? Well, I could ask the same question another way. That say I tell you vessel 1. Okay, well, we know that vessel 1 is a brachiocephalic trunk. What artery or what vessel does that empty into? Does that flow into? So I would expect you to be able to name either that or that. Okay, so next up here are so your brachiocephalic trunk. Again, this will be my uh, brachiocephalic trunk right here. That breaks into the subclavian and the carotid artery. So the carotids further break into 2 parts. So they break into the internal and the external carotid arteries. And so the internal is this one. That's my internal, and here is my external. Okay, and other vessels to note. So from the external, that branches here into my facial artery. So that's my facial artery. See that branch right here? That's my facial artery. Okay. And then you have your superficial temporal artery. Again, that's going to be right there. Superficial. So that's the branch right there at the top. Okay, this is your temporal bone, remember? So that's the temporal artery. Okay, so that's that. Moving along here. Now, if you go to the arteries of the upper limb, so we know the subclavian now. So when the subclavian reaches your armpit, your axilla, so it becomes the axillary artery. So that's going to be that. And from there, once it leaves the axilla and gets to the biceps brachii, it becomes the brachial artery. And then, of course, further down, it will then split into the ulna and the radial artery. So um, the ulna is that one. So it's the more medial one. It's the one, if you held your arm in the anatomical position, it's the one that is closer to your body. So the ulna. And the number four here would be what? My radial. So that's the one on the other side. That's the lateral one. Okay. And it goes to your wrist and your hands, both of them. Okay. All right, let's move along. So now we've done the upper limb. So the next is the abdominal aorta. So we did say that the abdominal aorta is, it flows down from, is right, is essentially the extension of the aorta beneath the diaphragm. Okay. And so here you have first a huge cephalic trunk. Oh, sorry, celiac trunk, not cephalic trunk. A huge celiac trunk. And that celiac trunk branches into three smaller vessels. So first, I'll come back to it. Then you have so in order, there's a superior mesenteric artery, and you have the inferior mesenteric artery. So those are big arteries that I would like you to know. And then you have your renal arteries that go to your kidneys. So those are big, huge branches. And by the time you get to your pelvis, it splits to the two legs, and so it splits into a common iliac artery. So there's a left and the right common iliac arteries, and those eventually will split to become the femoral arteries, which we'll talk about. So, so that's my celiac trunk, and it breaks. So that's my celiac trunk. It breaks open into three separate vessels. So you have your left gastric artery, your common hepatic artery, and your splenic artery. So again, let's look at those. So the left gastric artery, that is, it goes partly to the stomach and partly to the esophagus. It's this one that kind of branches up. Why? So that one right here. Your stomach is somewhere around here. The kidneys are there, but they are at the back. They are peritoneal. They're more towards the back. So this here becomes your left gastric artery, and the branch to the right, that one becomes your common hepatic artery. Okay, becomes your common hepatic artery. Now, so what about the third one? The third one right here. Let me use a different color. Is your splenic artery. So that's your splenic. Okay. So in order, it is the, so if I go clockwise in this figure, or from top bottom, first one here, the top one is my left gastric. The next one actually is my splenic artery, and the third one here is my hepatic. Okay. And the mesenteric we already identified previously. So there's two of them. There's the superior and the inferior. The superior is this big one right here, and the inferior exits way at the bottom over here. And of course, your renal arteries you cannot miss because they go to the kidneys. So I can also label the same things here. So my left gastric artery, That's that one. My common hepatic artery. Again, the hepatic artery here. So your, if you think about it, your stomach is on the left, your liver is on the right. So there you go. That one becomes my hepatic artery, and you can see it go to the gallbladder, towards the gallbladder, towards the. This is all the liver. This is the liver. Okay, and then um, the third one here is your splenic artery. Okay, then the arteries of the pelvis and the lower limb. So we already talked about here the common iliac artery. So this here is my common iliac, and it splits into the external and the internal. Oh, so this is, so that's internal, and this one here is external. And by the time the external gets to the femur, it becomes a femoral artery.